excerpt of this very fascinating chat, you can log on to CNN News 18's YouTube channel and watch that full interview to get lots of insights on what next for content creation and celebs. But talking about celebs, recently Bollywood actor Preity Zinta candidly opened up about her struggles with IVF and the emotional challenges she faced before welcoming her twins. Now, this was through surrogacy and with her husband in 2021.
Right. Her husband, Gene Goodenough, and her have both been very open about their entire journey. She herself has revealed that she underwent multiple IVF cycles. Then they decided, let's not go with that route. Let's instead go with surrogacy. We still live in a time, even though we're more and more seeing women come out and talk about it, it's still exciting to see each woman come forward, actually feel like she can share her journey. Preity Zinta admitted that it was challenging to maintain her public persona. She's always been someone who's bubbly, sunshiny, the dimples. But she said it was hard to maintain that during these difficult times. Take a look.
Parenthood is where all love begins and ends, and Bollywood actress Preity Zinta knows it all too well. She welcomed her twins Jai and Gia with her husband Gene Goodenough in 2021 via surrogacy. Only recently we got to know that surrogacy wasn't her first choice. In a candid conversation with Vogue India, she talked about her personal struggles with IVF in vitro fertilization before she and her husband decided to go for surrogacy. The actor shared that she sometimes felt like banging her head on the wall and cried during that most difficult phase. Her statement leaves us with many questions. But first, what is IVF? IVF, in vitro fertilization, is a process of fertilization in which an egg is combined with sperm outside the body in vitro or glass. During the process, mature eggs are collected from ovaries and fertilized by sperm in a lab. An IVF cycle typically takes around 6 to 8 weeks. The process includes an initial consultation, ovarian stimulation that lasts 8 to 14 days, egg retrieval, fertilization, embryo transfer, and a pregnancy test. The embryo transfer and pregnancy test are typically performed 5 days after fertilization. The chances of having a healthy baby using IVF depend on various factors including age and the cause of infertility. But is it risky or not? Let's understand from an expert.
Well, IVF is not a risky procedure because it's generally done under good control, but any procedure comes with its risks. One of the major risks with IVF is hyperstimulation. That is where too many eggs end up growing. But now there are protocols which do ensure that there is no hyperstimulation, and even if hyperstimulation does occur, it can be controlled very well, and all it requires is maybe an extra day of admission where we just give you saline rather than anything else. Besides that, anesthesia-related complications would be applicable to all patients, and that's not just for the IVF procedure, but that's for any other procedure. So per se, IVF is a relatively safe procedure which does give you good results as well.
Moreover, research says failed IVF process is associated with increased anxiety, depression, stress, and can impact self-esteem and confidence. Fertility drugs can also cause sleep disturbances and disrupt sex drive.
We've discussed IVF, for example, on the show before. We've had experts come in and really talk about the fact that more and more you're seeing urban Indian women, despite the high costs, because that was something we talked about. Despite the high costs, you're seeing women try to go in for it. Some are considering.
You see, the thing is, every pregnancy is different, every child is different, every human being, their construct is different. But still in today's day and age, when medicine is the name of the game, if you can't explore and the taboos, we've got to talk more and more about it, and that's the only way. So good to have celebrities actually come out and speak up on these issues. But enough said about that. We are also looking at markets this morning. Let's bring you around.
Let's go.